So in this episode, we look at marvelous Marvalon, the combined birth control pill. Now Marvalon is on the higher end of the spectrum for hormone levels. So let's take a look at some of the side effects you might experience if you're placed on it. Number one is headaches. The manufacturer noted this in 22% of users. Now, I find that personally hard to believe, as I've been prescribing it for over just about 20 years and I have yet to see anybody who's had significant headaches from it. What I suspect is that this is just an illusion because the manufacturer described the drugs and side effects but did not include their placebo arm in their reports. So if I look at a similar class of birth control pill like Yaz, for example, they also quoted headaches in 31.5% of users. But they did report the placebo arm, so in the fake pill users, they also had headaches at a rate of 30.1%. So that shows you right there that the majority of that effect, about 1%, was just unrelated to the birth control pill itself. And I suspect that's the case with Marvalon too. All right, next up is period pain, and that was complained of in 12.1%. Again, I find that a little suspicious because most people's periods are already painful, and one of the reasons that will place you on a birth control pill, a combined one, is to reduce the painfulness of the periods. So to me, that's a bit of a survivorship bias that the entire group of people being placed on this drug already, in general, a lot of them have very painful periods to begin with. That's why they're going on this pill, not just for birth control. So again, I don't know the veracity of that statistic. I would say that in practice, I don't find it that common. Now, even weirder was a complaint by the manufacturer of users saying that they had upper respiratory tract infections in 6.3%. Again, that makes no common sense to me whatsoever and is contrary to what I've seen and experienced. So again, I suspect that this might just be some sort of an artifact from the way they've reported the data without including the placebo arm of it, which to me is a huge oversight on their part. Number 4 was complaints of bellyache, and that was in 5.8% of users. Again, that can be a little hard to distinguish because periods can cause bellyaches. At number 5 was nausea, and as you know, all medications have the potential to cause nausea, and that's in 5.5% of users. At number 6 was breast pain, and that came in at 5.1%. And again, that is not uncommon with hormone birth control pills because they do affect the reproductive system, including the breast. Next up was back pain. That was number 7, and that was in 3% of cases. Again, my suspicion here is that a lot of you with period pains often will also complain of back pains because the uterus is in that general vicinity. So again, I don't know how much of that is really because of the drug and how much of that is just by virtue of having a period. All right, these next two I have not really encountered in my personal experience. One is diarrhea, that was in 2.3%, and vomiting 2.1%. So I don't know what to make of that, but anecdotally, I can't think of any clients that I've had in the past 20 years where vomiting or diarrhea was a significant effect from the birth control pill and not perhaps basically just a secondary effect of their period itself. Number 10, which I actually have seen, is mood changes. So it could range from depression, feeling jittery, etc. It's not super common, 1.8%. And that largely has to do with Marvalon being on the higher end of potency for the birth control pill. So it can affect your mood in some people who are sensitive or prone to mood fluctuations to begin with. And last one that's of note, while not common, was does it cause weight gain? That's a common question. It was hard to pin the manufacturer down on that question. They basically said that there is a possibility of 1 in 10,000 cases. They did not say to what degree, and they also did not confirm that it really was because of being on their product. So unfortunately, I cannot answer this question, but I can say that anecdotally, again, because it's on the higher end of the spectrum for hormones, I have had some females complain of cyclical weight gain and weight loss. So it increases, then as the hormone drops during the period, the weight comes off again. It's more of like a form of bloating rather than true fat weight gain. So I hope this helps you in your choice. Thank you so much for watching, and you're welcome.